The Indian government has issued an advisory asking people to mask up in crowded places and get their 3-dose vaccinations. Random COVID-19 testing of international passengers has also resumed at airports. States have been asked to send all positive samples for genome sequencing so we know sooner rather than later if we should be worried about another wave of COVID-19 infections. Please don't panic. I know this is not the kind of news you want to end the year on. Cases in India are not rising just yet. The number of active cases is under 4,000 and the government has not imposed any mandatory COVID protocol. These are just precautionary moves given a massive COVID wave unfolding in China, driven by the BF.7 variant of Omicron. 4 cases of this variant have been found in Gujarat and Orissa. All 4 have recovered completely in home isolation and one was asymptomatic. The BF.7 is not a new variant. It was first detected in India in July this year and has not caused any significant spike in our cases. To refresh your memory, Omicron arrived in November 2021 and since then it has been given off branches which divide into smaller branches. Of these, BA.2 and BA.5 proved to be stronger than the rest, and if you remember, we had a close brush with them last winter. BF.7 is a subvariant or descendant of BA.5. It is very highly transmissible. It has a shorter incubation period, that is, symptoms show up faster, and it has a higher capacity to cause reinfection or infect even those who are vaccinated. BF.7 has been detected in the US, UK, and European nations like Belgium, Germany, France, and Denmark, and cases are rising in South Korea, US, and Japan. But the eye of the storm is currently in China. Top epidemiologist Eric Fiegelding predicts that more than 60% of Chinese citizens are likely to be infected over the next 3 months, with death tolls approaching the millions. Plural. Many of you think of this as alarmist, but there are some signs of this being true. I say signs because there is a little chance of knowing the actual extent of COVID-19, actually anything happening in China. And especially now, when the Chinese government has stopped counting the asymptomatic people in its COVID-19 tally, it has also said that it will only count fatalities of people who tested positive and died of respiratory failure. So we don't actually know the true death toll either. The World Health Organization is very concerned about the situation and has urged China to give detailed regular updates on the number and severity of cases as also deaths. Anecdotally, on social media and news reports, ICUs are filling up and pharmacies are running out of at-home testing kits and even cold and fever medicines. News articles talk of dozens of hearses queuing up outside Beijing crematoriums this week, even as China reported only a handful to no deaths on many days. Wu Zhenyu, the chief epidemiologist at the Chinese Center for Disease Control and Prevention, said that the current outbreak would peak this winter and run in 3 waves for about 3 months. He made the remarks at a press conference in Beijing. According to Wu, the first wave would run from now until mid-January. A second wave would likely follow soon, triggered by the mass travel of hundreds of millions of people across the country for the Lunar New Year starting on 21st January.
So as Pallavi is suggesting, China is in for a very tough couple of months, which will be made tougher by the country's inability and its reluctance to keep track and transparently share the data with the World Health Organization. Now the question is, what has happened suddenly? Why is all of this in the headlines suddenly? Why is China in such a bad place, but Indians are being told not to panic? Well, number one, over the past month, the Chinese government has dismantled many of its strict zero COVID measures that have been in place for the past 2 years. Now, these were measures that were judged by the West. They were judged even by many of us in India as simply too harsh. Number two, also in an attempt to reopen the economy and catch up with the rest of the world that frankly seems to be moving on, China has suddenly ended the mass lockdown of entire cities. They have lifted restrictions on travel within and between regions, and they have allowed infected people to isolate at home instead of in centralized facilities. So after 2 years of not even being able to walk through an area where there were some COVID-19 cases without either getting tested or sometimes even quarantined, Chinese citizens, experts are saying, have very low natural immunity and herd immunity. In fact, their exposure was so limited to the virus that once those safeguards have been taken away, the virus that is now in an evolved and perhaps more infectious avatar has literally hit them like a pile of bricks. Making this worse is the poor vaccination uptake by Chinese citizens. Remember, a large percentage of the population is old. And those who have taken the 2 or 3 doses are finding out that Chinese vaccines aren't very effective at all, especially against this variant, which can cause one infected person to infect at least 16 others. China's refusal to take vaccines from the West and insistence on making it on their own has also costed time and money. So, while many other nations vaccinated their populations in 2021 and boosted in 2022, rates of vaccination in China are comparatively low. Only about 50% of the population there has received 3 shots. Now, compare this to India, where we have a high hybrid immunity. So, most of us have either received 2 to 3 doses of the vaccine, or have been infected and recovered, or have gone through both. Which is why, even though BF7 has been around for over 6 months, India's COVID-19 numbers remain at an all-time low. Now, this is not to say things can't change very quickly, given how transmissible this variant is and how it can affect those who even have some kind of immunity. Which is why you've heard the government has ramped up surveillance and is asking all of us to be alert, especially with the holiday and, might I add, that party season coming up. Now, there is all the humanitarian reason to care about what's happening in China, and we must. But remember, any disruptions in China disrupt the world. It is the world's largest factory. Entire companies and even countries can come to a standstill if or when China's factories and borders start closing. If China diverts its medicines and raw material for medicines for domestic use, we are going to see the shortfall here in India and, of course, elsewhere in the world as well. And, of course, if we are not alert or fast enough, remember the virus can once again spread in India like it first did in December 2020 when a student returned from a Chinese university. I'm going to stop here for today. The only end message here is please resume wearing those masks, the N95. Please wear them if you are in a crowded place. Get 3 shots of a COVID-19 vaccine as soon as possible. And before I go, just a reminder, I know it's the festive season, but remember to subscribe to this channel on YouTube. It's the bell icon, and you simply pressing that button helps an independent news and information team like ours tremendously. I also want to take a moment and get you to press that super thanks on YouTube. It's the heart icon with that $sign. It comes just below on the right hand side of the screen. You can make a small or a big contribution and stand with Newsworthy. Remember, we keep you informed and sane and smart. I'll be seeing you once more before 2022 ends. But from our entire team here at Newsworthy, thank you so much for your time and support.